But C fibers, which compose about 85% of your nervous system, okay, not the big fat myelinated fibers, but the thin, unmyelinated, slow fibers, actually secrete neuropeptides. Now, neuropeptides are substances that regulate the body. We talk about hormones, and one of the regulatory mechanisms that the hypothalamus uses is neuropeptides and hormones. It also has a nerve signaling component to it as well. The hypothalamus controls the autonomic nervous system. The autonomic nervous system controls your heart rate, your blood pressure, how you sweat, just all kinds of functions that you don't think about. You know, when to take a breath, when not to take a breath. That's why it's called autonomic. We'll get into that a little bit more this afternoon on how we can actually modulate the autonomic nervous system and keep it in a state of relaxation called the parasympathetic side. And the sympathetic side is the fight or flight side. But right now, we'll talk about C fibers and the fact that C fibers produce substances called neuropeptides next. Okay. Interestingly enough, the way we stimulate C fibers to secrete neuropeptides is with high voltage. Let's see, I already showed you that picture of the different diameters of the nerve fibers. And there is a mathematical law that says that the smaller the diameter of the nerve fiber, the more voltage it takes to stimulate it. And this is the big difference between a lot of electrical stimulation devices and Avazia Best, in the fact that it actually works at 10,000 times less amperage, but much more voltage. Voltage is very short and pulsed. In fact, the signaling on this device is off about 99% of the time. Only 1% of the time is this signaling device on. You can also activate C fibers with infrared lasers, and there are other things that you can use, like capsium. Anybody know what capsium is? Capsium is the stuff that's in jalapeno peppers. Okay, that's a biochemical stimulation of these C fibers, and that will also cause them to secrete neuropeptides. But in order to stimulate a C fiber, and this is a real important point to remember too, is you have to have high voltage. So high voltage will actually stimulate a C fiber versus low voltage and high current, and that's a traditional TENS device. And that's based again upon some rose-colored glasses that the medical community has worn since the 60s, that basically it's called the gate theory of pain. In other words, if we think of these big fat fibers as carrying pain signals, and we can fill that big pipe up with a signal that squeezes out the pain signal, then we can block pain. And that's what a TENS unit does. It actually fills up the pipeline that feeds the pain information to your brain, and it basically blocks out the pain signaling. Problem with a TENS unit is the body's real adept at figuring out how to go around those pain pathways and get back up to the brain, and the brain perceives it. That's a phenomenon called habituation or accommodation. And usually a TENS unit will last maybe 30 days and it'll be done for, because the body's just real good at figuring out how to bypass those filled up pipelines with other pipelines to get the information to the brain where it perceives pain. If we can stimulate C fibers, we can secrete neuropeptides, which actually last for 6 to 8 hours. Next, let's go to the next one. Okay. So this unique, very high amplitude signal is used to stimulate C fibers to produce neuropeptides and regulatory neuropeptides. And that's a lot different than the pain gate theory. The pain gate theory says we fill up the pipeline. This theory basically says we stimulate C fibers to secrete substances that deal with pain, and that these substances circulate in the nervous system and the bloodstream for many, many hours. They actually produce cascading effects, which actually dampen pain. That's why when you can use one of these type of devices and the pain goes away, and the pain will stay away for 6 to 8 hours, depending upon the intensity, that explains it. The fact is that we've produced a class of compounds called neuropeptides that circulate, and they actually help deal with the pain. Next. Okay, one of the things I put this slide in here to remind you that when you put best signaling on the skin, or you can, again, a lot of different devices, when you trigger the nociceptors that I showed under the skin, you actually cause all the nociceptors within the field of influence of that signaling to fire at the same time. That's another real important point. That makes us so different than a lot of other devices. If you can get all those nerve fibers to fire at the same time, you're going to send a much stronger signal to the spinal cord and the brain to turn on the synthesis of neuropeptides. So I put this in here just to remind you that that's another mechanism that makes this thing effective, and this type of signaling or this type of stimulation of nerve fibers is if we can cause them all to fire at the same time and synchronize their firing.